I think now it's gonna work. Let's see. Can you hear me? Hello, hello. Let's see now. Let's see now. Now we are live. I think now we are live. Let's see. Let's see. Okay. Now we're streaming on both platforms. Welcome to today's Cracking with Dr. Zeke. Welcome. Hi, Geishla. How are you? We are live. Well, today I organize a Q&A or questions and answers, preguntas y respuestas. Pregúntale al quiropráctico. Ask anything to the chiropractor. Now we are live. I'm sorry, I apologize. We were having some technical issues, but apparently we are live, okay? We are live. Yeah, it's the first live. Welcome. Let's wait for more people to connect. You can type your question on the comment bar on this chat on Instagram. We are, I think, also live on YouTube. Okay, we are live on YouTube. Okay, we are live on YouTube. Okay, we are live. Now, welcome Mary Lenny. Welcome, bienvenida. If you have questions, si tienes alguna pregunta, conéctate y déjamela saber. Vamos a estar discutiendo algunas preguntas que me dejaron algunos pacientes y pacientes que les pregunté, ¿verdad? A todos mis pacientes. I asked to all my patients to leave a question on comments on a post at the office, and also we okay. My producer says that I need to take my camera a little away. Let's see. My producer says that I have something. Let's see. 1 second. Good. Well, leave your questions here. Put your questions on the post. We have two people. Okay. Let's see. We're supposed to be live right now on YouTube. Let's see. Yep, we have a live right now. Okay, we have 4 viewers on YouTube. Whoa, nice. Well, some of the questions that some patients leave. Well, we don't have. Yes, someone else connect. Let's see. Some of the questions that some patients leave, like in some followers on Instagram, I've been leaving. Sometimes they ask if chiropractic is safe, and the answer is yes. Chiropractic is very safe, especially when it's performed by a licensed chiropractor like me. Chiropractic care, the manual adjusting, the instrument adjusting, it's safe, it's effective for many common conditions. Some of those can be headaches, feeling fatigue, feeling tired. It's not only always like being, you don't need to have a pain to come see the chiropractor. Okay. Other questions that other patients leave is how it works, but we as chiropractors, we restore joint mobility. We improve the nervous communication between your brain and your body. Okay. And we promote natural healing. You know, the body has the power to heal itself. Okay. And we do that. We reestablish that connection, adjusting the spine. Okay. And for that, most of the time we need to talk about how important, right? It's the alignment of the spine. Well, when you do repetitive motions, right, those vertebrae are gonna start to move, and they're supposed to move in synchrony, but most of the time they can get stuck. You know, when you do repetitive motion, most of the time, right, they get stuck and then start to put pressure on that nerve. Okay, and putting pressure on the nerve is not the same thing as a pinched nerve. Okay, two different situations, right? When you put pressure on that nerve, that communication is going to be interrupted. It's like having a kink on a hose, right? And most of the time, once you have that pressure on that nerve, muscles start to get tight, okay, and gets hyperactive is what we call it, okay? And muscles start to get tight until pain can knock the door, okay? Pain is normally the check engine light that is gonna cause you some issues, okay? But that's what we do. We look for those bones, those two bones that are misaligned. We align them again, right? Put them back in place, restoring, unkinking that hose, that nerve, and the communication to the muscle can be reestablished. And at that point, boom, we have muscle relaxing, body start to work better, okay? We call those misalignments in chiropractic subluxation or spinal misalignment, okay? Now, other questions that I hear from some people out there is if we can treat headaches. Yes, we can treat headaches. If his chiropractic care is good for sciatica, yes, it is. Chiropractic is good for sciatica. Can children see a chiropractor? The answer is yes. Okay, pediatric chiropractic care is gentle and is highly and very specific. It's tailored to the developmental needs. Most of the time, even some existing patients of mine, they ask me, can I bring my kids? But that you're gonna crack them, you're gonna pop them. Well, number one, that pop is a sound. It's just air. It's called cavitation. Okay. And another thing is we do manual adjusting, but it's highly, highly gentle. It's completely different to the typical spinal manipulation that we do in adults. Okay. That means we see pregnant mommies, we see babies, even newborns. Okay. Yeah. That question was answered. Then, why would a child need chiropractic care? Well, number one, to support spinal development, okay? To start to keep a good posture, okay? It can help with colics. It can help with ear infections and general wellness, right? Right now, even at the clinic, I have two patients that they have diagnosis of autism, and we start to notice that they have a better behavior, okay? They have less tantrums or meltdowns, okay? It's highly recommended for everybody, even for animals, okay? Some other questions that I see here. Can I go too much? Well, over adjusting without clinical need, it isn't needed, okay? It is not recommended, okay? Most of the time, we as chiropractors, we guide you through that answer. Some patients need more frequent care. Some other patients require less care or less frequent, is what I mean. Chiropractic care, it's highly needed. In my case, I go to the chiropractor, go to see my colleague at least twice a month. Sometimes I go weekly, depending how my body feels, okay? Once you start to get adjusted, you notice when your body is not working properly, okay? That is highly important, okay? Then we have 4 viewers. That's great. Please share the live. It's important to share the live. Share it. Send me your questions. You can send it via email. Also, by the way, you can send your questions right now to our email. You can send your questions right now to our email, mendedchiropractic@gmail.com. You can send questions right now in this live. If you send them via email, you can send it to us immediately. mendedchiropractic@gmail.com. You can send your questions right now on this live and I will answer them en español y en inglés. Si tienes alguna pregunta sobre la quiropráctica, sobre mí como doctor, que me hizo estudiar quiropráctica, o cualquier pregunta que tengas, any question you may have about chiropractic, about the care, how it can help your health, you can send your questions also to this email, and we are gonna answer them here right now on this live. Don't forget to follow us on Instagram and TikTok, and on my new YouTube channel, Today's Cracking with Dr. Zeke. Okay. Please share this live. It's important to share this live. It's going to help us a lot. Let's see here. Well, other things that we can talk. Let's see here. Other questions that some followers are dropping off. Do chiropractors prescribe exercise? Well, yes. Some chiropractors recommend rehab at home, or we can do those exercises also at the office, at the clinic, okay? Most of the time, those exercises, those rehab exercises are going to complement those adjustments that we provide, okay? Uno de nuestros pacientes nos preguntó si nosotros prescribimos ejercicios o hacemos terapia física en nuestras oficinas. Sí, ok, sí. En mi oficina podemos hacerlo. Muchas veces yo oriento al paciente, ok, y les enseño cómo hacer ciertos estiramientos, ciertos movimientos que pueden hacer para complementar los ajustes, ok. We prescribe at Mended Chiropractic, we prescribe exercises. Most of the time we do some physical therapy, some modalities, algunas modalidades en nuestra oficina para complementar esos ajustes quiroprácticos. Okay. Another follower sent an email to us and it says, are chiropractic adjustments addictive? Well, the answer is no. Most of the time people enjoy how they feel, right, after, and may choose to return regularly. Well, normally I recommend patients that are in wellness care or maintenance at least twice a month, or you must check up if you injure yourself. Depends on it's a case by case basis, right? ¿Son los ajustes quiroprácticos adictivos? Pues la respuesta es no, okay. Muchos pacientes, mucha gente les gusta cómo se sienten después de un ajuste quiropráctico, okay, y muchas veces pues deciden retornar regularmente. Normalmente en nuestra oficina recomendamos un buen mantenimiento, un buen cuidado de mantenimiento quiropráctico es al menos 2 veces al mes, okay, at least 2 times a month, okay, twice a month. Otra pregunta que sale mucho en los periódicos, en las redes sociales, ¿es peligroso ajustar el cuello? Pues la respuesta es no. Ok, las complicaciones que pueden ocurrir con un ajuste o manipulación espinal en el cuello son bien raras. Ok, it is dangerous to adjust the neck. Well, the answer is no. Serious complications for spinal manipulation on the neck are very rare. They're rare. Normally, proper screening ensures safety, right? Normally, in cases like seniors, right, patients that are older than 60 at least, normally they can create calcifications on some arteries going through the neck. And in those cases, we order x-rays and we try to screen and see that it's safe to adjust in the neck. It is safe, if it's safe or not. Okay, no. Normalmente, ¿verdad? Cuando vamos a ajustar el cuello, por lo menos esta es mi perspectiva como proveedor, es que muchas veces después de ciertas edades debemos ordenar radiografías para ver que sea seguro ajustar el cuello, ya que después de ciertas edades, después de cierta edad, muchas veces podemos sufrir calcificación de las arterias vertebrales o de las arterias carótidas, y muchas veces pues un ajuste quiropráctico en ese tipo de pacientes pues incrementa un poco el riesgo serio de complicación. Ahora, es seguro, ajustar el cuello es seguro. El tú autoajustarte, if you self-adjust your neck, if you crack your neck, well, in that case you are on a high risk to cause a complication, okay? And second, that even that it feels good, it's not properly, because what you're creating is laxity, okay? You're creating instability. Estás creando instabilidad en el cuello, o sea que no debes de ajustarte tú mismo el cuello. You must not supposed to crack your own neck, okay? Come and see us, and we evaluate your neck, we evaluate your spine, and we work it out in a secure way, in a proper way, okay? Some other questions I see here. Someone asked me, is one visit enough? Well, rarely. It's very rare, rarely. Most conditions require multiple visits for long-term improvement, okay? And when I say multiple visits, it's important to mention that it's a care plan. We as chiropractors, we work with care plans, right? Where you're presenting a situation, okay? You're having vertigo, you're having dizziness, you're suffering of GI issues. In those cases, we need to see the big picture, right? We can order labs, x-rays, and we can see those areas in the spine that are communicating at that level in the spine that communicates with that area, right? We must evaluate first, okay? Sometimes some patients that they just want and I call those the patients that just the one-stop shop, they have a headache and they need to get adjusted. Normally those patients are wellness patients, and they know, and this is a fun fact, between 85 to 95% of the headaches that you can suffer in your lifetime, most of them are originating from your neck, okay? They're mostly originating from your neck, okay? The most important one. Does insurance cover chiropractic care? ¿Es el seguro médico cubre el cuidado quiropráctico? Well, let me tell you that many plans do. Most insurances do, especially when it's PPO commercial and workers' compensation, workers' comp, okay? But coverage varies by provider, okay? Not all providers are gonna be on network with that insurance, or it depends, it's a case by case, it depends on the provider, right? ¿El seguro cubre el cuidado quiropráctico? Pues la verdad sí, muchos planes médicos cubren cuidado quiropráctico. A veces tienen unos límites, ¿no? Le puede que aprueben 12 visitas, 25 visitas, dependiendo el caso del paciente. Muchas veces la aseguranza puede cubrir, pero muchas veces son aseguranzas privadas, ¿ok? Planes médicos comerciales son los que pueden cubrir ese tipo de cuidado, ¿ok? Muchas veces se requiere precertificación, ¿ok? Another question here is, do I need a referral to see a chiropractor? Well, depends on the case. Mostly, no. Usually not. Chiropractors, we are considered primary care providers. We're PCPs. We can be your PCP. In the case of Medicare, it's different. In the case of Medicare, it's different. Sometimes you require referral. But if you have a PPO insurance, if you have a preferred provider options, normally no. Normally, maybe we need to submit some documentation to start care, but out of that, yeah, it covers most of the time. ¿Necesita un referido para hacer el quiropráctico? Pues usualmente no. ¿Okay? Los quiroprácticos estamos considerados como cuidado primario, así que no muchas veces no requiere referido. How much does a chiropractic visit cost? ¿Cuánto cuesta una visita quiropráctica? Bueno, sin plan médico, sin aseguranza, el precio puede rondar entre los $40 a $100 por sesión, por visita. Todo depende de los servicios que se te estén proveyendo en el momento. Ok. Without insurance, a chiropractic visit can cost around $40 and $100 per session. It depends what services the chiropractor providing to you. Okay, if it's just the adjustment, they have their service fee. Okay. Are payment plans available? Well, it depends on the clinic. Okay. In our clinic, yes, we have payment plans, and we have also adjusting memberships. Okay. You can go to mendachiropractic.jnapp.com and you can see our packages or calls, okay, to our office. Now, sí, ¿existen planes de pago disponibles en algunas clínicas quiroprácticas? Bueno, sí, hay clínicas que sí, que tienen planes de pago, y otras que ofrecen otro tipo de servicios como paquetes de visitas, paquetes de cuidado prepagado, entre otras, ¿no? It is chiropractic care covered by Medicaid. Hello, Lorelaine. Welcome to our Instagram live. Bienvenida, Lorelaine, a nuestro live en Instagram. Well, it is chiropractic care covered by Medicaid or Medicare. Well, that's a complex one, right? Because Medicare can cover only spinal adjustments. Normalmente Medicare va a cubrir ajustes quiroprácticos, solamente el ajuste. Nada de terapia física, nada de modalidades. ¿Okay? En ese caso, y el Medicaid varies by state. Medicaid varies by state. El Medicaid va a cubrir dependiendo del estado. Hay ciertos estados que pues no cubre el cuidado quiropráctico. If I have some people connected here from Puerto Rico, in Puerto Rico they cover some chiropractic care. I think it's an amount of visits in specific. Now, Medicaid, again, varies by state. In the state of Illinois, where I'm at, it covers a portion. It covers a big portion, but not all of it. Okay? And it depends on the provider, too. Some providers, they don't accept Medicaid. Okay? But they must accept Medicare. No Medicaid, but Medicare, they're supposed to be registered and accept it. Okay? Ahora, now, any questions? You can send us questions in our email. You can send us questions in our email, or you can put it on the chat on Instagram, and we'll be able to answer your questions. Okay? Puedes hablarnos, puedes dejarnos un mensaje o comentar en el live. Bienvenidos a todos los que nos están viendo. Este es el Dr. Ezequiel, Dr. Zeke. Okay. The Mended Chiropractic in St. Charles, Illinois. Déjanos un comentario. Leave a comment on the live. You can share this live. You can share the YouTube. Please subscribe. Follow us on YouTube also. We're going to be discussing more stuff about chiropractic and about life. Right? You can follow us on YouTube. Today's Cracking with Dr. Zeke, and on Instagram and TikTok with Mended Chiro Dr. Zeke. You can see it on the letters here that are moving. Aquí en las letras que se están moviendo puedes ver y darnos follow, seguirnos, suscribirte a nuestro YouTube channel. Okay. Okay. Vamos a ver, ¿qué otras preguntas tengo aquí? Que nos ha enviado. What other questions we have here at our I print all them that they send me. I start to collect questions since beginning May, and now we have tons in here. Well, someone asked me, and this is a colleague maybe testing me, my philosophy, my chiropractic philosophy knowledge. Said, what's the chiropractic philosophy of healing? Well, in essence, right, the body has the innate ability to heal itself, okay? When interference is removed, okay? It's the flow of life, right? We as chiropractors, we follow a mindset called ADIO, A-D-I-O, ADIO. Above, down, inside out, okay? You know, your body has the capacity to heal itself, okay? But remember that our brain is connected to our body through the spinal cord. And when those nerves that come out, right, they come out of the spine, like you can see here on this, here. Oh, this way. I'm still learning on this, guys. You can see here our spinal cord connects with the brain and monitors everything that happens in our body, right? When you have a small interference in one of those bones, boom, you start to have some issues, right? That can involve headaches, low back pain, neck pain, lack of concentration. You cannot focus properly, okay? Now, like someone asked me here, alguien me preguntó aquí también, debe haber sido un colega que mandó esta pregunta. Dice, ¿cuál es la filosofía de sanación de la quiropráctica? ¿Qué es lo que nosotros creemos como quiroprácticos? Bueno, nuestro cuerpo tiene la habilidad innata de sanar por sí mismo, pero tenemos que remover toda interferencia entre el cerebro y nuestro cuerpo. ¿Okay? Es bien importante saber que cuando la columna vertebral se desalinea, eso crea una interferencia, lo cual va a provocar que el cerebro no pueda detectar lo que está pasando en esa área del cuerpo. Ya son dolor de estómago, sea indigestión, entre otros problemas. Okay? Remember that you can send your questions to mendechiropractic@gmail.com. Puedes ponerlas en el chat aquí en YouTube, si nos estás viendo por YouTube. Okay. Okay. Vamos a seguir live. Vamos a ver si más gente se conecta. Let's see if more people connect. We're gonna be connected until 7:10. Okay, we're gonna be connected until 7:10 today. We're supposed to start at 6. We start 4 or 5 minutes late because we were having some technical issues. Okay. We're gonna be here connected. Let's see if more people connect. We have 7 views on YouTube at least now. That's great. Okay. You can ask me any questions you may have. We're connected. We're live. Okay. Yes. T-Fits88. Can chiropractic help while breastfeeding? Yes. Yes, he can. Yes, he can. Yes, he can. Especially for mom, you know, holding the baby, latching with the breast. Yes. We need to adjust mommy, and we must adjust the baby. And if baby is having trouble laying to that side, rotating his head to that side, we know that we are having some issues there. Yep. Great question. Okay. I still don't know how to put music on this thing. It will be nice to learn how to do it soon. Now, someone asked us about activator technique. Well, that's a very gentle technique. We use those instruments with patients that normally maybe don't like the manual crack, and they just want the mobilization of the bone, the vertebrae. Okay. Good. Manual crack, and they just Oh, we're connected and we have viewers. That's great. That's great. We have people watching our first live. That's great. I really appreciate that. Thank you. Muchas gracias a todos los que han estado viéndolo. Pero por favor, comenten, compártanlo. Please share the link. And we're going to be organizing another live soon. You can ask me any questions you may have. Okay. Here we have a question on the TikTok chat. And it tells, do chiropractic adjustment hurt? Well, most patients, they report relief. Most of the time, they report relief. And they even present improved mobility. Okay. Some, after a chiropractic adjustment, you can feel slightly sore. Okay. You can feel a mild soreness afterward, but it's similar to a post-exercise stiffness. Okay. It's, if you come with pain, you're not going to live with more pain. It's what I'm trying to say here. Okay. Los ajustes quiroprácticos duelen. Pues la realidad es que muchos pacientes reportan sentir alivio. Yo creo que eso es bien importante, ¿no? Que sepamos que el ajuste quiropráctico no duele. Sí puede provocar un poco de molestia después de, ¿no? Porque y es el mismo tipo de molestia que sentiría si va al gimnasio, ¿verdad? Y hace ejercicio físico, ¿no? Actividad física. Puede sentir un poco de molestia después de. ¿Okay? Por eso normalmente nosotros recomendamos que pongas hielo, ¿no? Que pongas hielo para poder controlar la inflamación y esa nueva fuerza que fue puesta ahí para corregir. Yep. Any other questions? You can type in English, you can type in Spanish. We'll be able to see you. We've been for the last 33 minutes. We have people connected. That's great. On YouTube, we have more people on YouTube than we have on Instagram, but that's great. Please share this live. With that, you're going to help us to continue connecting. And please also suggest topics. You can also send topics or questions you may have about chiropractic care, about Dr. Zeke, about me, about our clinic, Mendel Chiropractic, that is located at St. Charles, Illinois. Okay. Any questions anybody have? Let's see what other questions we have here. Let's see. Whoa, great question here. What does holistic care mean in chiropractic? Well, holistic means whole, right? Treating the whole person for the perspective of body, mind, and lifestyles, not just symptoms. As a chiropractor, there's something very important that I learned back in school, and it's that we don't treat symptoms. We correct a problem. We go to the cause. We go to the reason why you're having that problem, and we correct it. Then it doesn't happen again. Okay, that's our main job as chiropractors. Can chiropractic care cause a stroke? Well, the risk is extremely rare. About 1 in several million adjustments can cause a stroke. Oh, that's a good one. How do I know if my chiropractor is good? ¿Cómo yo sé que mi chiropractic es bueno? Well, you must look for their credentials, communication, transparency, patient-centered care, and outcomes. I think, ¿cómo yo sé que mi chiropractic es bueno? Pues básicamente mira sus credenciales, ¿no? Mira sus credenciales, ve cómo se comunica, la transparencia, si el cuidado es centrado en el paciente, ¿verdad? Y cuando hablamos de cuidado centrado en el paciente, estamos hablando de que él está atendiendo tu problema o le hace lo mismo a todos los pacientes. ¿Ok? Tienes que estar pendiente de eso. Can chiropractic care delay the surgery? ¿Puede el cuidado quiropráctico, ¿verdad? Retardar una cirugía. Bueno, en muchos casos sí. In many cases, yes, it can delay a surgery. Even I experienced that some patients avoid surgery, having consistent care, very consistent care, following what we call a care plan. Okay. What if I have a spinal fusion or hardware? Well, chiropractors can often still adjust, right? The joints above or below of the fusion. And we can do some soft tissue techniques to keep your body working properly. Okay. What other questions we have here? Do elderly patients respond slower to care? Well, healing may be slower. Remember that you possibly are having that situation for already more than 6 months, years. I even saw patients that they come in and I ask them, hey, how long you been having this situation with your low back? Well, it's been since I fell 10, 20 years ago, and now it's, I wanna correct it. Well, that's a big principle in chiropractic that says that every process requires time, right? It took time to put you there, and it will take time, right, to take you out of there. I think that's very important to know. Okay. Do chiropractors treat workers' comp injuries? Yes, we do. Many are certified. Many of us, we're certified to manage work-related musculoskeletal injuries. I think that's a very important one. Yes, we do. A little complicated, but still we do. Can adjustments correct flat feet? That's a very good one. Not directly, but chiropractors may refer out or suggest orthotics. Some of them will suggest orthotics. Do chiropractors work with orthotics? Some of them do. Me personally, I don't. I believe in them, but I don't sell them. Right? I think a good support, it can help. It's a factor that we can take in consideration, but we don't sell orthotics at our clinic. Okay, we specialize more on the spine. We work with extremities. We can order labs, we can order x-rays. We can treat you as a whole, but in the point of prescribing orthotics, we don't. We do some physical therapy also. My favorite. Can a chiropractic evaluate my gait? YES. Yes, and in capital letters, we do. We can. We can evaluate your gait. We can evaluate your posture, and we can identify the imbalances that you are presenting. Okay, we can. Yes, we can. Yes, we can. Another question that we have here from another Hispanic patient. I will translate it a little here. Will adjustment help with my balance or prevent me to fall? Well, yes, we can. The chiropractic adjustment will improve the spinal alignment in those two bones, okay, and will help you with coordination and proprioception, right? Proprioception is the capacity for the body to identify your balance in time and space, right? Yeah, because when you adjust the spine, there's a better communication. It's a great reception towards the brain, detecting what is happening around you. I think that's very important. That's very important. Other questions that we have here. Do I need to keep coming forever? Well, the answer is no. But many patients choose to continue coming and continue maintenance care to prevent relapse. And I think that's a very important one. I think prevention it's very important. I think prevention is key. Not only as a chiropractor, as an epidemiologist and public health practitioner, I need to say that prevention is key. If you don't prevent, if you don't take vitamin C or you don't keep your spine aligned, how are you gonna confront the world? When you get on a chiropractic adjustment regularly and you keep your spine aligned, what we normally say, when was the last time you get your spine checked? Go get your spine checked, because keeping your spine aligned is gonna help you to adapt better. Okay, I think that's very, very important. Okay, it's important to keep your spine aligned, because that will improve your immune system. Okay. It's like going to the dentist. You go every and the dentist you go every 6 months, and now insurances can cover 3 times a year. But remember that you go 3 times or twice a year to the dentist because you brush your teeth every day, but you don't adjust your spine every day, right? That means you must get your spine checked regularly. Don't wait until you have pain. Don't wait until you have a symptom. Don't wait until your body has that check engine light on, because that will take longer. Okay, it will take longer. It's very important to keep your spine aligned, keep and prevent. I have patients that they text me and they call me to the office and they say all the time, "Hey doc, I was doing the ER and I don't know, but something is not right." And I ask them, "Do you have any tenderness?" No, I just want to be checked. I want to be able to wake up tomorrow morning with no problems, with no restrictions. Stop by, I'm here. It's very important to be conscious of checking and taking your health seriously. Okay. Good question here. Should I get adjusted before or after a flight? Well, before or after, we'll be able to help you with the stiffness and joint compression from traveling. What should I wear to a chiropractic appointment? This is a tricky one. Use comfortable clothes. I'm not gonna say use comfortable clothes that allow movement. For the ladies, in my personal opinion, don't come using short dresses. Even that at the office, we can put your towel around. We have a small sheet and we can cover you. But come with comfortable clothes. You can come with comfortable clothes. Some patients come with, if they're using a dress, normally they bring shorts or they bring sweatpants to put on in the female cases, right? But it's very important, be sure of that. What is the biggest myth about chiropractic? Oof. Some people said that it's not real, right? There's no real healthcare. Let me tell you, in fact, okay, it is a licensed and regulated profession in most countries, okay, and very popular, very popular. I think we are moving towards hello, 11 de Abril, welcome to 11 de Abril to or Instagram Live. Bienvenido a nuestro live. Puedes hacernos preguntas en español o en inglés. You can ask any questions in Spanish or English about chiropractic, about me, about anything you want to know about in healthcare. Okay, if I have the answer, I will give it to you. Okay, or you can email your question to mendedchiropractic@gmail.com. Okay, we're more than welcome to answer your question and educate you more about chiropractic. Okay. Let's see here. Do medical doctors support chiropractic care? Well, things are being changing. Okay, I need to say things are being changing. I think now more than ever, I see many MDs, many medical doctors referring me patients, for conservative musculoskeletal care, to take care of their spines, to take care with their muscles. I think I've been seeing that a lot. Recently I had, I think it was 2 or 3 patients in the same month that was referred by this orthopedist, ortho doctor, and it's very interesting. When I see the referral, they fax it to me, the patient's schedule, and I was like, that's nice. We're moving towards a more conservative situation. And something I need to mention, this matter, our body has a limit, okay? Our body has a limit, and it's very important to mention that because, no, chiropractors, we cannot cure cancer. But it's been proven that when we adjust a patient, even that it's through cancer treatment, right? Chemo, radiotherapy, radiation. I think it's important to mention, it's true, we cannot cure a cancer. We cannot cure a STI or an STD. We cannot cure those things. But there's a lot of research, and if you want me to share with you, you can just send me an email. I'm more than welcome to share with you. There's a lot of research that been demonstrating that a chiropractic adjustment, a spinal adjustment that is specific, okay, an adjustment that is specific can change completely how your body's reacting. Or like I said a couple seconds ago, the way that your body adapts to the environment. I think it's very important to say. Okay? I think it's very important that we see that way. Okay? But it's chiropractic care is beyond. My personal experience, I was an asthmatic kid. Okay, I used to have asthma and deep penetration, and I'm a 90s kid. Okay, I'm a 90s kid. It's the penetration was, they were prescribing me all these inhalators and nebulizer, albuterol and Proventil and Pulmicor and all those things. And the penetration, all those inhalers were not working properly for me. And she talked to my dad, and she recommended chiropractic care. And I remember I was around 6-7 years old. And I went to this chiropractor, and he took x-rays on my neck. And after a couple sessions, I'm not been using an inhaler until now. You know, I think that's a win-win for chiropractic. You know, it's key. It's very important. But again, chiropractic care can help you with everything in your life. You know, you're an athlete and you wanna feel better. You wanna have better performance. Remember that when your joints are aligned, you can move better. Your joint mobility is peak, it's top. Okay, it's very, very key. Okay. Now, let's see. Yeah, we answered that one. Let's see. And we're checking here. Can chiropractic help with arthritis? Yes. Yes, it can. Can chiropractic help with arthritis? Yes. Well, it doesn't cure arthritis, and this is very important, right? Inflammation of the joints, but it can reduce the stiffness and improve the function. Okay, that's very important. Does chiropractic care improve sleep? Yes, especially if pain or the misalignment was interfering with the rest. I think that's very important. I see patients, that come to the clinic. They come to clinic and they tell me, "Hey doc, I'm having headaches." And it's like, okay. And normally I ask them how's their sleep patterns, how's their caffeine intake. But most of the time I ask them, "Do you have neck pain? Do you have any neck issue?" Because they say, "I cannot sleep." It's like, okay. Or they come with neck, or they come with low back, or they come with other conditions or other situations. And normally I adjust them, and the next visit they tell me, "Hey doc, I was super tired after the adjustment. I took a nap." Or I sleep like never in my life. One of those days that you lay in bed, you close your eyes, you fall asleep, and you wake up in the same position you went to sleep. That's a good sleep. Okay, that you didn't even move. Hey, your body was healing. Your body was reconnecting, catching up with all the delayed messages that you were having due to that kink on the alignment, on the spinal alignment, right? Let's see what other questions we have here. Please follow us on YouTube, subscribe, and turn out the small notification bell. Please follow us on YouTube. Today's Cracking with Dr. Zeke. We can see it here passing through. Today's Cracking with Dr. Zeke. You can follow us on Instagram and TikTok. Mended Chiro Dr. Zeke. Mended Chiro Dr. Zeke. Any other questions for me or for anything here? Well, we are 3 minutes away for 7. We have 2 email questions. Let's see what questions we have. 1 second. Let's see. We have 2 questions via email. We have here, la quiropráctica puede ayudar a manejar los dolores en la espalda, cintura y las piernas. Can chiropractic help to manage back pain, waist pain, like low back pain, and leg pain? Sí, la quiropráctica puede ayudar a manejar los dolores de la espalda, cintura y las piernas, reconectando los mensajes, ¿no? Y ayudando con la tensión muscular en esas áreas. Otra pregunta que tenemos aquí, la quiropráctica puede ayudar con dolores de cabeza y cuello. Sí, la quiropráctica puede ayudar con los dolores de cabeza y cuello. Y muchas veces el dolor de cabeza viene porque el cuello está desalineado, a lo que le llamamos dolor de cabeza cervicogénico. ¿Ok? Cérvico quiere decir cervical, significa cuello, y génico es origen. El origen se origina del cuello. ¿Ok? Pero sí, puede ayudar grandemente. Grandemente. Bueno, si tienes una pregunta, puedes enviándolas por correo electrónico a mendezchiropractic@gmail.com o puedes ponerla en el Instagram Dr Zeke. Puedes dejarlo en español, en inglés. Puedes seguirnos en nuestro canal de YouTube Today's Cracking with Dr Zeke. Danos like, por favor. You can give us some like, and then our material can be shared forward and be part of the algorithm. This is my first live. Maybe I'm changing a little the topic, but I've been trying to go in a live long time, and this is my first live. I really appreciate anybody that it's been connecting. It's really an honor to be live. At the beginning, maybe I was having some technical issues, but I'm super happy. Now I will say in Spanish. Gracias a todos los que se han conectado y me han puesto preguntas en el email. Por favor, síguenos en las redes sociales. Dr Zeke, Today's Cracking with Dr Zeke. Nosotros venimos con mucho material y muchos videos para publicados en YouTube coming soon, pronto. Y de verdad les agradezco a todas las personas que se han conectado, nos han dado like, se han suscrito. Yo creo que es bonito empezar algo nuevo que me trae alegría, así que les agradezco un montón, de verdad, que me estén apoyando. I really appreciate that anybody that's been taking a little time to no matter how many, but there's people connecting, and that's key. Okay, please share, follow us. I really appreciate every single person that connect on this live tonight. It's my first live. I'm very happy. I think you can see it. I'm super happy. I was super nervous at the beginning, but I really appreciate it. Please follow us. You can send me any questions you may have, anything that you want to know about chiropractic, about health, right? What else? Oh, no one asked me what I do for a living. I'm a chiropractor, but I also am a college professor. What else? I love to talk. I think you can see it. I love to speak up. I mean, that's great. What else? But I really, really appreciate it. Obviously, first I need to say thank you to that big fella up there. God, first of all, for letting me connect tonight, even that I was having technical issues. If you want to know what we're publishing on the YouTube channel, we're going to be talking about life experiences. We're going to be talking about a little about chiropractic, but also a little about health. We're going to bring you interviews coming soon. We're going to have interviews with different professionals and different specialists in different areas, not only in the healthcare. And if you have any suggestions of what we must talk on the channel, or what you want to know, any topics, please email it to us or send us an inbox on Instagram, Dr Zeke. Si tienes algún tema que quieras que nosotros hablemos en nuestro canal de YouTube o en un en vivo y quieres saber más, por favor, mandarnos un correo electrónico, o nos puedes también dejarnos un comentario en el Instagram, en el TikTok, o incluso puedes dejar un comentario abajo del live en el YouTube channel, en el canal de YouTube. ¿Okay? De verdad les agradezco. Espero que tengan una muy bonita noche. Son las 7:03 en Illinois, en Chicago, Illinois, o en St. Charles, Illinois, y 703 here in Illinois. And I know my mom is looking at me. Thank you, mom, for connecting. Gracias, mami, por conectarte. Y sé que papi también tiene que estar viéndome y Mari también, así que gracias por conectarse a todos, de verdad que sí. Muchas bendiciones a todos y los veo en el próximo live. Coming soon. Espero no tener ningún problema técnico. I hope I don't have any technical issues in the next live. But a lot of blessings for everybody. Important, go to church tomorrow, Sunday. Take some time, go to church. Go listen the message from God. Okay, it's very important. Peace.